I'm Dr. Jerry Hesch, a physical therapist at Hesch Institute in Aurora, Colorado. And this is my client, Kelly. And in February of this year, she had surgery for her moderate to severe scoliosis. And you can see the image here. And also this image, what a significant improvement in frontal plane alignment was achieved. She also has some pelvic floor dysfunction and some low back pain, especially when she's sitting. And I'd like to demonstrate how she has a pelvic asymmetry, but it's not a movement dysfunction that can be aligned, that can be corrected with stretching and strengthening. It's actually the way her pelvis developed. And on close inspection, you would probably note there is a little bit of asymmetry in that pelvis from side to side. So let me clear my table and I'll have her lay on her back and I'll show you that asymmetry. Okay, on your back, please. So Kelly is lying on her back. And I get to play cameraman. And I don't know if the camera's going to see it in the same way that I see it. Legs are symmetrical, her body is lying symmetrical, her leg lengths are symmetrical. I've screened the pubic structure, it's equal on the top. The front face of the pube is equal all the way down upper, middle, and lower third. But her ASIS's anterior superior iliac spine is lower on the right, and it's also more prominent towards the ceiling. Now, if this was a pattern of pelvic movement dysfunction called anterior ilium, motion would be blocked when I try and take up the slack through the structure here and when I try and spring it. But it moves very freely. If she had a pattern which we call posterior ilium, which actually involves the whole pelvis as it moves on the hips, may or may not involve the sacroiliac. But if she had that pattern, motion would be blocked going inferiorly on this side. And motion is free. Let's have you lie on your stomach. And she's lying very symmetrical. And what we see is, to the best of my ability, I would say that the PSIS's, posterior superior iliac spines, are fairly symmetrical. And the very top of the ilium on both sides, the right side is higher. This side is higher towards her ear. Okay? You could say again that maybe she has an anterior ilium on the right and that's why it's higher, but that would block movement in this direction. And I can take up the slack. I can spring through that structure and I can see her feet bob up and down. So this does not meet the definition of an anterior ilium. It only meets the positional definition, but not the movement definition. Now, if the left side was a posterior ilium, then motion would be blocked going superiorly, and it is not. So the conclusion, and I've also checked ligament tone in the sacrotuberous ligaments, and that's equal. So the conclusion that I draw, which makes perfect sense given her history of moderate scoliosis, is that her pelvis developed asymmetrically. Now when she stands or when she lays down, the body adapts nicely to that asymmetry. But when she sits in a chair, the chair is symmetrical and it tries to force her pelvis and spine into symmetry. And she sits for a prolonged period of time, whereas when she's upright, she's walking around, changing position frequently. She works as a piano instructor, so she does have to spend a lengthy amount of time sitting at the piano. So we want to modify her seating surface so that she can sit with the chair matching the asymmetry of her pelvis. So we've already experimented with her, and we found out that we did not have to put anything under her ischium. But what we found was that using a 1/2 inch, I put 2 pieces of cork together and then I taped it. By adding a 1/2 inch pad behind the right ilium, greatly increased her sitting comfort. And the same thing for this foam device. It's a foam pill. It's a stress ball, actually. You get to squeeze it when you're stressful, but we dipped it in rubber dip 3 times on each side, and that goes under her sit bone. The good news is she uses a back support. And so we're going to put this 1/2 inch thick cork. You could also use craft foam that you could buy at Hobby Lobby or Michael's or any similar store. Joann's Fabric would also be another store. So now she has a 1/2 inch padding behind the right ilium. So go ahead and come sit, please.
Okay.
And then put this under the left trochanter. Very good. So that blue pill, if you will, foam, is just in front of the left pocket. And can you tell us how you feel when you're sitting?
It does definitely feel better than when I sit on just a chair by
Nice.
itself.
How so? How does it feel better?
It feels like for my pelvic floor dysfunction, the muscles are kind of like relaxed a little bit more. I think that'll happen more with time, but like it's like right now the edge has been taken off.
Very
I
good.
would say, yeah.
Very good. And one of the clues that I use is looking at symmetry of your legs. And before we added these enhancements, this femur was taller on the right. Let me check my camera. Okay, yes. So the right femur was taller towards the ceiling, and the left femur was longer than the right, and they're fairly symmetrical as far as I can see visually. So that's kind of a marker that I utilize. And I would also look at heights of the pelvis in the front. Then we could put her on a stool and look at heights of the pelvis in the back. But we already experimented with her sitting with a lift under the sit bone, first on the left and then on the right, just to compare. And we found that was not necessary. But for people with severe scoliosis, it would be helpful for many of them to have a pad that they sit on. So it takes a little bit of experimentation. And so the whole point of this video was to show a developmental asymmetry of the pelvis that looks like what people call anterior ilium or posterior ilium. But because there was no movement dysfunction, we conclude that that's how your pelvis is developed, and therefore we use these foam props to improve your sitting comfort. So I sure thank you for letting us film you.
Thank you. Yeah.
And it's pretty exciting to see that scoliosis surgery.
Yeah, absolutely.
Glad you're doing better.